Welcome back to the Council of the Americas virtually. Delighted to have everybody here for what promises to be a really interesting conversation on Venezuela and the coronavirus and the health system there broadly. The truth of the matter is we wish we didn't have to have this conversation, but we do. It is timely, and we're delighted to have been able to attract such an A-plus roster of not just speakers who we're going to hear from shortly, but also attendees. The RSVP list for this meeting is not just large, but it's also extremely impressive. So we are very thankful all of you have chosen to spend some time with us this morning. We have decided, because of the topic and because of the strength of the panel, we're going to extend the program for a full hour. So we're going to be going until noon today, Washington time. We hope all of you can stay with us for that extended period of time. My name is Eric Farnsworth, and pleased to be your host this morning. This meeting on the health and migration impact of the coronavirus on Venezuela and the regional response is part of our healthcare working group activities. It's also part of our Venezuela group activities. And I want to thank Guillermo Subiaga and Zoe Douth for their excellent work to help put this together, as well as our entire technological team. Without them, these remote meetings simply, literally would not be possible. So we thank them for their great work on our behalf. Our sponsors for the health series, you all should know by now, but I will repeat because we are very, very pleased to have their continued support. Merck, Pfizer, Roche, and Sanofi. As well, a couple of very brief meeting notes before I introduce the panel, and that is that this meeting is on the record. It's also going to be conducted in English, and I know that a couple of our speakers are doing us a favor by speaking in English. And we appreciate that. And the reason why we're doing it that way is because we want this program to have as wide a reach as possible in the halls of authority that need to hear about it. All of the attendees, all of you, will be on mute for the entire program. We will have a period of time at the end after the comments to be able to do a question and answer period. And the way we're going to do that is through the chat function of WebEx. If you could send your questions directly to me, make sure it's a private chat. Otherwise, everybody on the list will see your question. And just to try to confuse you a little bit, my contact is DC Laptop 2, DC Laptop 2, which you should see at the top. And our host is ASCOA DC. So either of those will work just fine for the purposes of putting a question forward. With that, as I mentioned, we have an all-star panel that we want to get right to hear their views. We're going to start with Dr. Julio Castro Mendez, who is a medical doctor, and he's calling in from Venezuela. Dr. Castro Mendez is the COVID-19 Technical Experts Commission head of the interim government of Venezuela, and he's going to give us a sense of the scenario on the ground. We also have on the line right now Carrie Filipetti, who's the Deputy Assistant Secretary of State for Western Hemisphere Affairs. She is directly responsible at a policy level for Venezuela issues in the day-to-day. Many of you know her already, and Carrie, we're delighted to have you on online as well. David Smolansky is the chair of the Working Group on Venezuela Migration and Refugee Crisis with the OAS, the Organization of American States, and we all know that Secretary General Almagro was just reelected to another 5-year term on last Friday. So David, we are delighted to have you. You've been with us in the past as well, and we've done a much fuller introduction of you in the past. And then we also have Manuela Bolívar, who's a deputy from Miranda State in the National Assembly of Venezuela. And she is somebody who has a long history, despite being relatively young, has a long history in politics in Venezuela, and will have a political sense of some of the politics around these issues in Venezuela, certainly working with the Guaido interim government. So we're delighted to have all of you. For those who want a longer biographic information of our speakers, we do have that. It's on our website, www.ascoa.w. www.ascoa.org, www.as-coa.org. For that, Dr. Castro, perhaps we can begin the conversation with you. We've asked each of our speakers to speak for 8 to 10 minutes, give us a sense from their perspective of how they are seeing the issues, and then we will have the chance to engage with them, as I mentioned, in the time remaining. Dr. Castro, welcome. Thank you for joining us, and over to you.
Can you hear me?
Yes.
Okay.
Welcome.
It's an honor for me to share this panel with David and Mrs. Filipetti. Well, I'm gonna go deeper pretty much on the health system issues and how the Venezuelan humanitarian health crisis is gonna be one of the biggest driver in terms of the amount we think the pandemic is going to strike us in the next weeks or so. So I'm going to share some slides, but I don't have the share issue on. Maybe somebody do that. Is it possible to share my desktop? I don't have the share desktop issue on.
I believe our administrator can help you with that. But go ahead.
It's still not working. First, and then we can go back to the slides. The first one that I want to emphasize is that the Venezuelan health crisis has begun like 10 years ago. And I'm going to use some health outcome, international health outcome, as a crude mortality ratio or child mortality or maternal mortality as a biggest outcome to emphasize how big and how long has been the Venezuelan crisis. Because once you understand that here, can you see it? Okay.
Yeah, it's coming up.
When you realize that the health crisis has been going on from a long time ago, you are going to understand how weak we are right now to address the new crisis. Here you have the crude mortality rate line, which is from the beginning of the 21st century and has been growing up. I mean, this is a kind of impressive because it's the only one line in all the continent that has been rising in the last 10 years or so. Here in this slide, you see a comparative crude mortality rate in terms of percentage between Colombia, Peru, Ecuador, and Argentina. And Venezuela has been rising in terms of percentage close to 0.6, which means 6% per year, every year. It's mean people who has been dying that they shouldn't be dying right now. And this is pretty much related to the health system problem in the last 10 years or so. Here in this slide, we have the child mortality index in the almost the whole continent related to the increase. And as you can check, even compared to Haiti or Bolivia, Venezuela is the only one who has been going up in the last 10 years or so. So at the end, what I want to emphasize with this is that mortality has been going up. Also, child mortality is the same figures for maternal mortality, which are the basics outcome for health issue in any country. So at the end, we're going to have the bottom line of that is that we are in the worst shape to combat the epidemic. Let me go back to the slides. I'm not sure that I have the real pencil. Well, I cannot go. If you have confused a little bit here. Sorry for that. Somebody mess up. I want to share my desktop. I can no longer do that. You guys see my desktop or just the screen?
We can see just the screen. Totalidad infantil.
Okay, because somebody changed something here, and now I can not share the slides. Well, anyway, I'm gonna go ahead. We check for we check for other outcomes related pretty much to the pandemic preparedness. I'm not sure if you have it, but here I have the map, the international. Almost in the last 10% of the countries who are prepared for infectious disease threat. So this index, which is pretty much done for an international, well-known academic center, put us in the worst place in the continent and one of the last places in all over the world. And it's related especially to the preparedness in terms of infectious diseases. Here we have the figures of or everyday monitoring related to the PPE status. We have data from 40 of the bigger hospitals in the country. It's a countrywide monitoring system. As you check in Spanish, and I'm sorry for that, but when we check for surgical masks, which is the first bar, 61% of our emergency rooms in the bigger hospital do not have surgical masks right now. This is the yesterday monitoring data. Also, when we check for ICU surgical masks, we also are close to the 60% of the shortages of surgical masks in the ICU or emergency room. We ask also for the doctors if they are using more than one day the surgical mask, if they are using more than one day, which is not recommended. 70% of them are using the surgical face mask, which they shouldn't, for more than one day. So that's the or basic everyday monitoring in the ICU and emergency rooms. Also, this slide, we have the monitoring of water supply in those three bigger hospitals all over the last year. This is the monitoring of the last year. The red bar means that hospitals that do not have water at all, or they just have it once or twice a week. And the average for the last year is close to 75% of the bigger hospitals do not have running water in an everyday basis. So it can give you some ideas how we are prepared in terms of how to deal with this pandemic right now. Right now, the general situation is we have a chronic health system problem, which is structural causes, and is related mainly to the way the regime is managing the health system. We are in extreme vulnerability related to the weakness of our health system. We have a threat in front of us. We have been striking most of the biggest health system in the world. So in terms of the magnitude of the threat right now is the bigger we can think of. And we have a low threshold to health response in terms of number of beds, ICU beds, ventilators, or even medical personnel trained to cope with diseases in the emergency room. We have a little room for maneuver in terms of funding, logistic, because in some ways a global threat and everything that we are right now trying to do with trying to get into medical goods or even PPE or ventilators, everyone in the world is trying to find the same at this moment. So I'm gonna stop here. My main point is to emphasize that we are in the worst case scenario in terms of our preparedness as a health system to cope with this huge threat. And we need urgent logistics, urgent help, and urgent advice in terms of that we supposed to go to the worst part of the pandemic maybe in a month or so, according to our mathematical models and according to daily monitoring cases in Venezuela right now.
Well, Dr. Castro, thank you very much for that sobering assessment. Appreciate very much not just your willingness to share with us, but also your willingness to join us during very difficult circumstances. We hope you can stay for the balance of the program. Thank you very much for your comments. We're going to turn to Carrie Filipetti now. Carrie, as you all know, is Deputy Assistant Secretary of State for the Western Hemisphere. She's day-to-day air traffic controller. Carrie, can I say that, for U.S. policy on Venezuela? And it's a delight to have you back at the Council of the Americas as well. So from the U.S. perspective, give us a sense of how you're seeing some of these issues.
Sure. Thanks very much, Eric, and many thanks to the entire COA, to Zoe and Guillermo as well as to the other panelists who are here. Obviously, the interim government of Venezuela has been working this issue very closely with the United States government. One thing I want to note is that very recently, it was either yesterday or the day before, the United Nations came out with its $2 billion global humanitarian response plan for the COVID-19 pandemic. And in the entire world, it did also highlight specifically that Venezuela was a critical case, not just as Venezuela, but also as a possible regional focus too. And so it's critical both due to its existing shortfalls that Dr. Castro highlighted in its healthcare system, as well as because of the large migration crisis, which is now and has been the largest in the region, in the entire region's history. And so, one of the things that I always think about when I talk about this pandemic, and when, even just in my own personal life, is that one of the most important lessons that COVID-19 shows us is that what affects one of us affects all of us. And so that's why it's so important to focus on Venezuela, because it's not just an issue for Venezuelans for a lot of the reasons that were highlighted by Dr. Castro in terms of the systemic shortfalls in their healthcare infrastructure. But what affects one of us affects all of us. And if Venezuela is not able to address the challenges that it faces with COVID-19, then going into the future, going into Brazil, Colombia, the surrounding region, just as we've seen with the refugee crisis, we so too will see an expansion of COVID-19 pandemic in the region, if not globally, if Venezuela as a single country is not able to address it. So we really need to focus on exactly what this topic is, which is how do we address the crisis inside Venezuela? And I like to think about what is kind of needed in a pandemic of this size. There's three kind of core principles that I look at. The first one is transparent communications. The second one is quality infrastructure. And the third is personnel and having the resources and the capacity to really address the crisis. So when you look at transparent communications, we have a real problem here. The Venezuelan government, the Venezuelan regime currently indicates there are 91 cases, but the interim government has highlighted that there may be as many as 141 cases. We have seen the silencing of journalists who are sharing information, and I think Dr. Castro, who's really been leading the charge for Juan Guaido's interim government COVID response, he too has been threatened by the regime, and so I'm very appreciative of his presence here because it is not at zero risk for him. So there's no ability for us to get any real information and data on the ground as to how serious a crisis this really is for Venezuela. The second thing that I pointed out was having quality infrastructure. So combating COVID-19 in Venezuela is particularly complex because of all of the points that Dr. Castro just highlighted, which is the current crisis inside the country and the difficulties that are faced by Venezuelan refugees in the region as a whole. Before the COVID-19 pandemic, the crisis was already vast. There was 44% of hospitals didn't have electricity. The vast majority of Venezuelans didn't have access to soap and water. This is still true. As of December 2019, again, before COVID, 64% of hospitals lacked x-rays. And so the Maduro regime's gross mismanagement of Venezuela's health system over the last 20 years is exacerbating the current crisis. We know that there's only 84 ICU beds in the country as a whole. So just to put that in perspective, if you look at the current rates of the number of people and percentage of people who need hospitalization and need to be in an ICU ward, of those who are infected, those 84 beds means that the minute Venezuela gets over 1,500 cases, they are well over capacity to handle that crisis. 66% of hospitals in Venezuela don't have water. 90% of hospitals don't have protocols for respiratory virus care. And I think this is also important, even if it's not specifically a healthcare crisis, is that there's an inability for Venezuelan people to really stock up and store food to make a quarantine or a lockdown actually effective. We're able to do so in countries like the United States because we have access to grocery stores, we have access to food and to finances to pay for that food. But unfortunately, in Venezuela writ large, they do not have that capacity. The third point that I had raised was personnel. So the vast majority of doctors in Venezuela, of young doctors in Venezuela, about 75% by a recent estimate, have fled Venezuela as part of the 5 million who have fled during the refugee crisis. The remaining doctors tend to be an older age group, which actually places them at more risk of contracting the disease. And of course, the fact that we're in the midst of the region's largest refugee crisis is a significant factor here because those are individuals who are often finding themselves in extremely vulnerable conditions. They require shelter, they require vaccinations, and they require other services that their government has been incapable of providing for them. And so this is why it's really everyone's business to care about the damage of COVID-19 inside Venezuela and across the entire region. Especially since Venezuelans continue to cross the border into Colombia and other locations. So just to speak very quickly on the U.S. government's response, there's two ways that I would look at this. The first way is looking at the COVID-specific response. So the U.S. government's specific response via USAID and our Bureau of Population, Refugees, and Migration, which is also known as PRM, are really leading our international assistance efforts. They work directly with both governments as well as multilateral organizations, NGOs, and other organizations that are on the ground and responding to the outbreak. So to date, USAID has committed $100 million globally to combating COVID-19. And we're also looking directly into PAHO's appeal for $54 million to address an additional COVID response. The State Department and USAID have also submitted to Congress a plan to program nearly $1 billion that Congress provided in an emergency supplemental appropriation. And that will help us prioritize how to provide foreign assistance to respond to the pandemic. But there's a second thing that I would want to highlight here, and it's not just our response to the current crisis. Something that Dr. Castro mentioned that I think is really critical is that part of why this crisis is so severe is what has been happening to date and the mismanagement by the Maduro regime. So it's also about the kind of proactive and preventative measures that we have put in place over the last few years. We've been investing in public health, emergency response, and humanitarian programs in Venezuela and in the region for many years. Just as a quick example, since fiscal year 2017, we've provided $656 million, and approximately $473 million of that is for humanitarian assistance for both Venezuela and the region. For example, USAID provided nearly $8.2 million in emergency health programs, along with $6.8 million in water, sanitation, and hygiene programs in 2019 to help people stay healthy and stave off disease. These are the sorts of things that help provide some measure of inoculation against infectious diseases. And so that is something that a lot of our efforts have been put into over the last few years. PRM has also provided $208 million in life-saving assistance for Venezuelans who have been forced to flee. And it essentially provides core relief items like shelter, food, safe drinking water, hygiene kits, and other items like that. PRM also helps to register fleeing Venezuelans. This is a particularly vulnerable population, and that's to help ensure their access to basic services and facilitate their integration into host countries. So we're also working on responding to COVID-19 with locally sourced PPE. This is something that Dr. Castro highlighted is really missing inside Venezuela. And so our PRM partners are working with us on that, particularly in elderly home care facilities. So, obviously with what Dr. Castro and I laid out and what David and Manuela will lay out as well, the situation in Venezuela is extremely dire. The interim government has been doing an absolutely fantastic job in trying to draw attention to the crisis, ask for more assistance, and provide what assistance it can. I think that's evidenced by the fact that many representatives of that government are here on the panel today. And to combat COVID-19, though, we also need Maduro to, at the very least, cooperate with governments and international organizations who can help. Unfortunately, just recently, Maduro had actually threatened any agency that receives life-saving funding from the US. This was before the COVID crisis. So we're hoping that can change. We need to see truthful access to information. We need to, as an international community, respond to all of these various appeals. We need to make sure that we're providing PPE, soap, clean water, testing kits to Venezuela, which desperately needs them. We need to make sure that the Venezuelan government has the support that it needs, and that the Venezuelan regime is no longer trying to politicize this crisis. As I said, this is really a moment for us to realize that the entire world is in this together. What affects Venezuela affects all of us. And so we need to work collaboratively to make sure that we're addressing their needs. And part of that will, of course, require a long-term political solution so that we can build up the infrastructure and get the Venezuelan people the support that they really need.
Carrie, thank you. That was terrific. And I think that, from our previous interactions, Council of Americas is absolutely right there with you all and hoping for a better day, not just on COVID-19, but when democracy returns to Venezuela. We've been in the lead from a policy perspective on that, so we thank you for your comments. We're going to go to David Smolansky now from the migration perspective. The great segue that you talked about, that what happens in Venezuela affects the region. So I don't know if you planned it that way. We didn't script it intentionally, but it's a great segue. David, you've done a lot of work on the migration crisis and how the COVID-19 might be amplifying that and making it more desperate. Give us your comments from your perspective.
Well, thank you, Eric, and thank you, Council of Americas, for having me. It's a real honor to be at this panel, and I want to especially say hello to Dr. Castro and Manuela Bolívar, who are doing a fantastic job in Venezuela, even though they have been threatened and persecuted by the regime. That's the public servants that the country needs, and I'm sure that those are the public servants that we're going to have when we have democracy. And also say hello to Carrie, and always grateful with her job and all the U.S. administration putting the pressure to Maduro's regime. That, by the way, as we speak, Maduro has been accused with other high officials from the regime for drug trafficking. So that's the confirmation of that we are having a where we've been under a narco-state. So I will start saying I will start with that. I mean, what is to be with a pandemia under a narco-state? That's what the Venezuelans are facing, and that's one of the main causes of the migration and refugee crisis. As we speak, 5 million Venezuelans have fled the country. This is the largest displaced population in the world that have not suffered from a conventional war or a natural catastrophe. It's the largest migration and refugee crisis in the history of Latin America and the Caribbean. And even if we include those who have fled from a conventional war, Venezuelans are the second largest displaced population in the world after Syria. That has been suffering from a war for 9 years. More than 75% of the Venezuelan displaced are in 6 countries. Colombia, with 1.7 million Venezuelan migrants and refugees. Peru, with a bit more of 900,000 Venezuelan displaced. Chile, 450,000. Ecuador, 400,000. Brazil, 230,000. And Argentina, 150,000. But the situation here is that with the COVID-19, the vast majority of the borders of the region are closed. Of course, because of the social distancing that has been asked almost in every part of the world, a lot of governments have taken the decision to close the borders, not only the ones through the that you go through car or through a walk, but also by air. And this is something that will definitely impact a lot on Venezuelans, because every day, for example, with Colombia, more than 40,000 Venezuelans go through that border to Colombia, and 5,000 don't go back. I mean, 5,000 Venezuelans are fleeing daily the country. Of course, that is stopped right now because of COVID-19. Why Venezuelans are fleeing the country, we probably all know here, which are the reasons. First of all, the humanitarian crisis. There is lack of food and lack of medicine. The United Nations has said that 8 million Venezuelans are in need of humanitarian assistance. Second, the generalized violence. Venezuela is still one of the top 5 most violent countries in the world. Third, a human rights violation. Fourth, lack of services, specifically lack of electricity, water. And fifth, and not least, the collapse of the economy. So all of those are happening at the same time, and that is creating a migration flow similar, as I was saying earlier, when a country has a war or a country has a natural catastrophe. So definitely with the COVID-19, Venezuelan migrants and refugees are one of the most vulnerable populations in the region. Yesterday, there was a very important meeting between the interim government of Venezuela through its ambassador, Maria Teresa Velandri, and the Brazilian authorities that are taking actions, for example, on the refugee camps, that there is any Venezuelan with COVID-19 at the refugee camps in Brazil, they will be immediately isolated, and the Brazilian authorities are preparing for that. Fortunately, we don't have any cases of COVID-19 on the refugee camps in Brazil. Also, another thing that will be very important for the governments as soon as we tackle COVID-19 and we get back to our routine, is that because, as I said, I mean, Venezuelans, migrants, and refugees are very vulnerable in the region. It's very important that they don't suffer from discrimination, they don't suffer from xenophobia. A lot of them are really concerned that they could lose their jobs. Remember that a lot of them, if they stop working for a week or for a day, basically they don't have the money to pay the food that they need to eat, or they don't have the money to pay what they cost the place where they live. So I think it's very important that the governments should consider some flexibility, not only from its citizens, but also for the ones who have migrated to those countries. And remember, Venezuelans are not migrants. They have not fled the country because they want to. They should be considered as refugee. They have fled the country because they have not had any other option that to find opportunities in other place, or literally they have fled the countries. They have fled Venezuela, sorry, to survive. And I want to say something that Dr. Castro knows very well. For example, because of malaria in Venezuela, at least between 2018 and 2019, there are more than 320,000 cases. That's more than a lot of countries that are having coronavirus in the region, and at least 500 Venezuelans have died because of malaria. So what I'm trying to say here is that with the COVID-19, it's not that Venezuela is entering in an emergency because of the pandemic. Venezuela has been in an emergency for at least 5 years. They have been suffering from probably the worst humanitarian crisis that any country in Latin America has faced, even though with the resources that the regime has had during these 20 years. So it is very important for the international community. It's very important for the ones who are at universities, etc., that to understand that the emergency in Venezuela is not starting right now because we're going to face a pandemic. It's just things are going to get worse. I mean, it's important if different countries in the world are having a great health system are tackling with this COVID-19, like we're seeing here in the US, in Spain, Italy, France, Germany, the UK. Could you imagine this situation in Venezuela with a completely collapse of a health system? So Venezuela will keep needing support from the international community to protect its population. And as I have always said, the only solution to stop the migration flow and the only solution to stop the suffering of the people because of the humanitarian crisis is restoring democracy and freedom. And I think that this is an opportunity to accelerate the restoration of democracy and freedom in Venezuela, because otherwise millions of lives in Venezuela are in risk if this pandemic grows and grows in my homeland, because we don't even have transparency on the data that the regime is providing to Venezuela and the international community. And it is something that is not only important for understand for the international community, which I know a lot of countries understands it, but it also is very important for the United Nations to understand this, because the life of millions of Venezuela in weeks are in danger, are in risk with a pandemic that cannot be attended with the health system that is collapsed in Venezuela. So I'm going to stop with this. Thanks.
Well, that's terrific, David, and thank you for perspective. And you know, the point that you're making, let me emphasize it, that what makes this so desperate, it's bad enough on its own, but what makes it so desperate is it's coming at a time when Venezuela's health system has been collapsing completely over the years because of the actions of the regime. And so, you know, this is a particularly fertile ground for devastation. And every country is challenged by these same issues, but the ones with a collapsed healthcare system are the ones who are going to, you know, see even greater impact on the downside. And so appreciate that perspective, as sobering as it is. Thank you for reminding us of that. We're going to go now to Manuela Bolívar. I understand she's on the line now. Her connection may not be the strongest, so we want to hear from her nonetheless. So Manuela, Deputy, welcome to the Council of the Americas. And for the next 8 to 10 minutes, the floor is yours. Welcome.
Thank you very much for the invitation, and I'm sorry for my English. I'm trying to do my best, and thanks for making me part of this amazing panel. As you know, the world is facing a huge crisis, coronavirus. And when I think about countries like Germany or US that have nurses, doctors, equipment, medicines, medical supplies, and infrastructure that works, and even then are concerned about the scope and consequence of coronavirus. And I have to go back to my country and I see all the things that we have. And even worse, all the things that we don't have because of the regime put us with two more crises. That one of them is a crisis in humanitarian emergency complex crisis. And in the other hand, we have a huge economical crisis produced for a regime that put us in a model that destroyed the economy, destroyed the production. We have public service with a major failures. Our people do not have access to water, for example. 80% of the population does not have continuous access to water. But it's not only water, it's also electricity. 90% of the country has electricity service with failures or interruptions. We have a destroyed healthcare sector, abandoned hospitals with major shortage of essential supplies and medicines. And I talk about antibiotics, gloves, face mask, soap, alcohol, etc. In addition, 70% of the hospitals lack continuous access to water. So it's not only the population, it's also the hospitals. We have a complex humanitarian emergency since 2014 affecting our people. And when I talk about this, the regime put us, and I know this is a decision that a lot of governments and countries have taken, that is the isolation. But when I think in the Venezuelan population, we have 1 out of 3 Venezuelan that is not able to eat on a daily basis. And when you have that, these people have to choose staying in home with isolation, but that decision can produce that they maybe die for hunger. But in the other hand, the other option is go to the street and find some food for eating each day. But maybe if they go out, they have the risk to get the virus and also die. The probabilities for these people is really high for dying in both conditions. So in that case, the regime has took a decision. They implement a few years a system that is called Carnet de la Patria. But right now, through the Carnet de la Patria, they are thinking to help the people, sending money. But the amount that they are sending to the people is not enough even to buy eggs or meat or beef or cheese. That is not enough for a whole family. I thought about it. I thought about these things because it's not the only. It's not the crisis. The only crisis for coronavirus is the humanitarian emergency complex that we are facing, and in the other hand is the economical crisis that we have. We cannot expect in this situation that the people living in this condition wash their hands with soap and water every 2 hours, because you don't have water, you don't have money to buy soap. We cannot expect use alcohol-based antibacterial help if they do not have enough money to eat. You have to choose, you eat or you buy the help. You cannot expect the people living in these conditions to use face masks, because even the professional healthcare do not have access to them. We cannot expect these people living in these conditions stay at home, because as I say, you have to choose, or you live, or you try to eat something, or you stay at home and die for hunger. And when I put this situation, also Maduro says, well, we need to talk and we need to find an agreement. But when you go down and you see the actions that they are taking, we see also a huge censorship, huge persecution, not only to the politicians, also to the healthcare professionals like nurses or doctors that give informations about coronavirus. Also, we are facing the persecutions in the press professionals. For example, we have 2 journalists that they were put in jail from the FAES group, and we don't know their status. We don't know why they were put in jail, and why they were persecuted. We have members of the Congress in the same situation. We have people who, for only show symptoms, were disappear also from FAES group, or even worse, they were assassinated for armed group linked to the regime that for not ¿cómo se dice cumplir? Not abiding the isolation, they just shoot them in the street at Sunday in the slum of 23 de enero in Caracas last weekend. So this is a catastrophe. Maybe I want to finish my intervention with this. I think this situation put us in the worst scenario, because if I saw Italy have more resources than Venezuela has in the economicals and the healthcare system. But here in Venezuela, we don't have information. We don't have the real data that the cases of coronavirus that we have. We have persecution. For example, the regime doesn't allow to NGOs that work in humanitarian programs work freely and independent and to make their work, because, for example, last month, 4 NGOs were persecuted for the regime and took them all the medicines and all the food. For that reason, I think that the interim government is trying, in the first place, trying to find the more resources that we have and we can to support the NGOs and the organization. And in the other hand, we want that in Venezuela we have a independent and neutral
Well, there's nothing,
space.
absolutely nothing. No, I'm about to shut it off.
Have you spoken?
No,
I'm sorry. Se cayó.
Go ahead. Everybody remain on mute, please. Please finish up, Deputy.
So that's at commit. We are going to find the resources, and we want to the agencies, the UN agencies and international NGO has all capacities and logistic to make their work in the situation that we are having the regime in the power. Thanks for the opportunity.
Thank you. That was terrific. And I really want to compliment all 4 panelists for the seriousness of your comments, for your clarity of views, and you each brought something unique to the table. So we really, really appreciate that. In this new cyber environment, we're all trying to learn about the technology. So we appreciate everybody's patience to the extent it's required with some of the technological issues, but we are all in a new world, so we're figuring it out together. We have several outstanding questions that have been posed already, and we don't have a huge amount of time, so I'm just going to throw a couple of these out to some individuals. The first is Carrie. There was an announcement apparently already this morning about indicting the head, the de facto leader of Venezuela, Nicolas Maduro, for drug trafficking. And the question is, how might this impact the U.S. ability to address or to assist in some of the humanitarian issues? That's number one. I'm going to ask Dr. Castro for your thoughts about the capacity of the Guaido interim government to address some of these issues? I mean, you spoke about capacity of the regime. What realistically can the Guaido interim government do to assist the crisis? And then for the other two panelists, David and Manuela, there's a really interesting question about how this could impact the security forces, and to the extent that the virus begins to impact security forces individually and therefore their ability to maintain order. Is that some sort of a catalyst for them to support the Guaido interim government then, or would that change the scenario or the dynamic? What are your thoughts about some of that? So we're going to start with Carrie Filipetti on the issue of the U.S. ability to respond given some of the restrictions that we've been placing on the relationship.
Sure. Thank you very much, Eric. It's a really important question. And so for those of you who aren't aware, at 11 a.m., which is precisely when this started, the Department of Justice announced indictments on a number of Venezuelan officials, including former President Nicolas Maduro, for narcotics trafficking. At the same time, the Department of State, via our INL Bureau, announced a series of rewards for information leading to the arrest or conviction of these Venezuelan nationals, again, including Nicolas Maduro, also including a few others, including Tarek al-Assami, Diosdado Cabello, and a few others. So with respect to the question on how this will affect the humanitarian response, well, to date, the United States has had significant sanctions on the Venezuelan regime. All of those sanctions do have humanitarian carve-outs, and this is something that is especially important to bear in mind now. The regime continuously tries to make it sound as if it's the U.S. sanctions that have prevented any assistance from coming through. But as Dr. Castro highlighted, there were a number of crises well before U.S. Sanctions came into play. And most especially, the United States has made a concerted effort to make it clear that there are obvious carve-outs for humanitarian assistance, for medical supplies, and for food assistance as well. And so the Department of Treasury, in kind of an unprecedented experience, in August of this year, released a media note that emphasized these exemptions. And so that's something that we want to continue to publicize. So sanctions are not going to have an impact on curtailing the imports of any kinds of medical products or equipment. And certainly the indictments, which are against already sanctioned individuals, shouldn't have an impact on the delivery of humanitarian assistance itself. We also are working really closely, again, with the interim government, as well as with our NGO partners on the ground, and have been providing a significant amount of assistance, even in light of the existing sanctions, and will continue to do so.
That was pretty clear. Good stuff. Appreciate that. Dr. Castro, to you for the capacity of the Guaido interim government to address some of these issues, given the very real constraints that you and all the other panelists have already discussed. Please remove your mute.
Okay. Can you hear me now? Okay. Having in mind that we have a very small gap to make logistics for bringing food or PPE or whatever, we are focused pretty much right now on trying to connect funding through a logistical pipeline, which mainly will be United Nations system, to bring two stuff, PPE and alcohol-based gels for hospital and even communities. We are pretty much focused on that right now. And the second strategy, we are doing brainstorming. Actually, we have a meeting this morning, last night, to get all the Plan País guys related to services, funding, transfer, and having a brainstorming how we can help the people in terms to mitigate the social impact related to the pandemic. And we are thinking about transferring, we are thinking about helping communities related to the funding we can get in the international field. So these are our main focus right now.
Thank you. And so we're going to go now to David, to the extent you have thoughts about the security situation. Look, I mean, the security forces have been, other than the ones at the top who are deeply embedded in the corruption of the regime, you know, everybody's impacted in somehow the same way, right? Lack of food, lack of medicine, lack of education, everything else. But they have been maintained loyalty through various measures. At what point does an issue like the coronavirus as a black swan event begin to change some minds and some behaviors, or is this just not something that people would even think about?
Eric, I think this is a very important question because the main pillar that maintains Maduro and his crony in power, usurping power, is the security forces. Security forces, armed forces, different police forces, and also irregular groups that specifically during the last 18 months have increased in Venezuela. Irregular groups that were created in Venezuela as colectivos, and irregular groups that are from Colombia, for example, like the ELN. But this pandemic could create a breakdown in the security forces, because you cannot imagine, on the many times that I have visited the border, I have found police and soldiers that have deflected the country. But they just take the smallest opportunity that they have to leave the country. They take like the only day that they have free during a month, or the only morning that they could just ask for do personal things, and they use that to flee the country. Now they cannot do it because the borders are closed. And if you get coronavirus in Fuerte Tiuna, for example, which is the main military base of Venezuela, or you get coronavirus in other important air bases in Venezuela, the life of those officers are in risk, as and also the life of their families, and it will be very difficult for them to survive that because of the collapse of the health system that they know that is completely collapsed. So maybe this could accelerate a position from the security forces to become institutional, to obey the law, to obey the constitution, to protect the people, to not recognize anymore the dictator Nicolás Maduro, and to recognize President Guaidó as its commander-in-chief. And of course, if that happened, well, the dictator is over, and fortunately, we could have a pacific transition that will go to a free and fair election. So I think it could be an opportunity. And well, now if they collaborate to detain Maduro or Diosdado Cabello, Torreca Laizami, they will have a reward. So now you have another incentive to be institutional.
Thank you, David. And we're going to go now to Manuela Bolívar. You know, it's a similar question to what I just asked David, but I think he answered it pretty well. So let me shift a little bit. From your perspective as a deputy from Miranda State, very important state, very important equities in these discussions, can you give us a sense of how well, I'm having trouble phrasing it, but let me just ask in a simple way, that the restrictions that are being placed on the country broadly, how is it affecting the people of Miranda? And as a deputy, what are some of the things that you would call for to try to assist the people of your state?
It's difficult to think in an answer for that, because one of the things that are worrying us a lot of is that it's difficult to mobilize inside the different states and inside the country. For example, for the producers of food, that not also they can do it with normality, but also they don't have gas, for example. They can produce that in the couple of days we cannot find food in the market, and it's going to put us in a hardest situations in, ¿cómo se dice abastecimiento?
Supplies.
In supplies of food. But in the other hand, I think it's a system that is collapsing in different ways. For example, yesterday in a sector of Caracas, explode a tube of water, and a huge zone of the city doesn't have water because this tube doesn't work. But also it's a shutdown of electricity. But if you added the food, that doesn't find because there is no supply. So there are factors that going in this formula, they can be so catastrophic for the citizens, for the population. I want to agree. I want to add it to the question about the security and the police forces, that they are exposed as the doctors and the nurses. They don't have the equipment. They don't have the protection equipment. But we don't know if this is going to produce a breaking point. I want to think about it. I want to think that they are not also for their, they are like persons for their family also, because the truth is that in Venezuela, for example, the Secretary of Health of the regime say that we 2 weeks ago say that we have only 82 beds for all the country. And if I was a police, I think not also in myself, also in my family. And I think maybe it's going to be a factor to determine positions, not to be loyalty to the regime. It's maybe a Darwinistic position is to survive, because every Venezuelan right now is facing the death. You know, it's hard.
Yeah, it's a tragic situation. And so everybody, I know that we are at the appointed hour, but I do have one final question that I think has to be asked because it's come up now several times on the private chat with me. And Carrie, I wonder if I can just ask you for your thoughts. You know, obviously the preference is to work with the interim government to the extent possible, but the question is, under dire extreme circumstances, humanitarian circumstances, would the U.S. government consider working with the Maduro people in any way for the delivery of humanitarian assistance, or how are you viewing that and addressing that very, how do you say, current question?
No, it's a really important question. And as you know, one of the themes of what I said was that, you know, we're all in this together. And now is not the moment for any kind of politicization. And that's something that we're very much committed to, and we know the interim government is committed to as well. You know, the issue with working with the Maduro regime is really only one, which is that they do politicize the humanitarian assistance in the sense that they have frequently used it only to provide care and support to its own supporters and to its loyalists. And so we do need to make sure, as with any international organization, as with the UN, that any funding that gets there, any food assistance, any medical aid is being distributed is in an impartial manner. And that's a standard that we will continue to uphold. And it's also a standard that our international partners will continue to uphold. So that's one area where we wouldn't compromise, but we are committed to making sure that we're getting assistance there. And again, this is why we've been so firm about our carve-outs for humanitarian assistance, even going so far as holding conference calls with NGOs and other organizations to let them know that what they're doing, if they're providing food assistance, if they're providing medical care, is not in any way a violation of US sanctions. And so we'll continue to provide those reassurances as well.
Thank you for that. And, you know, the Maduro regime has paid lobbyists in Washington who are spreading a different message. So we appreciate your clarity of thought there. Ladies and gentlemen, I would love to continue this conversation. There's so much more to discuss, but we simply don't have the time. We've had 4 fabulous presentations, some from outside of the country even, and at some personal risk. So I really want to, as a personal note of thanks, to thank our panelists and also on behalf of the Council of the Americas. We're continuing to follow these issues. We will focus even more on Venezuela, but more broadly COVID-19 in the Western Hemisphere. We have several issues, programs, and events coming up along those lines, so we encourage you to stay connected with us. Virtually, of course, and we will do the same with all of you. Thank you. This would be the point normally where I would ask the audience, and we still have over 100 people online, to thank our speakers for their terrific presentations. So you'll just have to receive mine on behalf of all of our audience. Thank you very much. And again, I hope you'll come back to the Council of the Americas. With that, we are concluded. Enjoy the rest of your day. Best of luck and God save.